from VMC Asian College Foundation Incorporated. And today I am going to perform the Leopold's maneuver, return demonstration. Leopold's maneuver is a systematic palpation of the abdomen for assessing the fetal position and presentation. Prior to performing the procedure, I have performed hand washing. This is to prevent the spread of the microorganisms. And I have already prepared the necessary equipments, which are pillows, rolled towels, and stethoscope. Now, I have to explain the procedure to my patient to gain my patient's cooperation. Good morning, ma'am. I am Eman P. Gilay, your midwife for today. May I see your wristband, ma'am, please? Can you state your name?
I am Octopila,
And your birthday, please?
August 23, 2010.
Thank you. And today, I will perform Leopold's maneuver to determine the position of your baby. And I will also check your baby's heart rate using a stethoscope. So the procedure is safe and painless. It will help us know if your baby is in right position for delivery. May I have your consent to proceed?
Yes, ma'am.
Now, I have to let the patient empty her bladder because a distended bladder may slightly deviate the uterus.
Mom, I encourage you to please empty your bladder so that you get uncomfortable during the procedure. Yeah. Okay, mom, so now you are back. Let's continue to the procedure. Now I have to position the patient on supine with one pillow under her head and knees slightly flexed. This is to facilitate accurate assessment and providing comfort. Then I have to place rolled towel under her right hip to shift the uterus away from the large blood vessels and thus prevent supine hypotensive syndrome. I have already performed hand hygiene for your safety, and now I will now warm my hands to avoid causing uterine contraction. Mom, I am now going to expose your abdomen. So since I am right-handed, I am currently standing at my patient's right side. To easily grasp the symphysis pubis to be done in the third maneuver. So I am now going to proceed with the first maneuver, which is the fundal grip. So to palpate the urine fundus to determine what part of the fetus lie in the upper part of the uterus. So it may be fetal heel, which feels hard, round, freely movable, and ballotable, while the bridge feels softer and nodular. Now for the second maneuver, which is umbilical grip, I have to palpate in a downward direction of the sides of the abdomen by applying gentle but deep pressure. To determine the position of fetal extremities, fetal back, and other anterior shoulder, so we will know if it's fetal back if there is a long continuous structure felt, while it is extremities if we feel nodular, reflecting the portion of fetal extremities. Now, for the third maneuver, which is pollex grip, place one hand over the symphysis pubis and grasp the lower uterine segment between thumb and fingers and feel the presenting part. And for the last maneuver, which is the pelvic grip, to do this, we have to face the feet of the clients or our patient to confirm the findings in the third maneuver and determine the flexion, the vertex into the pelvis. Now, I will check your baby's heart rate. I will place the stethoscope on the area where I felt the fatal buck, since that is where the heart tone is loudest. So I'm going to do this in 1 full minute. So I am now hearing the fatal heart tone. I will count it for 1 full minute. Okay, so the fatal heart rate is 140 beats per minute. The normal range is 120 to 160 beats per minute. So your baby's heart rate is normal and reassuring. Mom, please continue to have regular prenatal checkups, eat nutritious foods like vegetable and protein, and report immediately if you feel no fatal movement, bleeding, or severe headache. So I will now document the findings. Vertical lie, cephalic presentation, left occiput anterior not yet engaged, FHT is 140 beats per minute, regular and strong. So do you have any questions, ma'am? Thank you for your cooperations. Keep safe and see you on your next checkup. So, after the procedure, we will going to perform hand washing for the hand sanitation again.